Have you ever, like, looked down in a napkin and had, like, particles of bone?
Particles of bone?
Well, kind of like chunks, maybe a
just
few
some junk coming out
boogers,
of your
but...
At the age of 66, Lanique looks fantastic. We're here to talk about your breasts, correct?
Yes. So at 37, I had my first breast surgery done. They were fine, except for I felt like I heard water. It was heavy in there. So about 12 years ago, I went to have them taken out and they put silicone in.
So they were still heavy because silicone weighs more than saline.
Yeah. Sometimes you know the bell rings, you just don't know what church. You know, it's going, whoa.
WTF.
Then it became encapsulated. So he...
Which side?
Left side
Left
is
side?
what I call my Frankenstein breast. And then he took that out and then didn't put the right size implant in it. They didn't match. So he said, we're gonna bring you back in and we're going to redo it. After he did that surgery, I looked down and there was this huge puckering, and I'm going like tuck and roll. And anytime he tried to fix it, he created another botch. It got botched, botched, botched.
Huh.
Actually, the nose, small tip. Oh, he's twisted.
Oh, yeah.
His whole nose is twisted and collapsed there on the right side. So I think there are things that we can fix here if that's what Vinny is trying to do.
Bring this guy in.
Please send in Vinny.
Hi, nice to meet you.
Vinny, hi, Dr. Nassif.
Hello, nice to meet you.
What's your name?
Andrew. My
a
best
seat.
friend.
Look at that color.
Aliens.
But what color? Aliens.
My favorite color is blue. Galaxy Realness.
What?
Galaxy Realness.
Galaxy Realness?
Yeah. Yes. So like when you're trying to like portray something, it's realness. So like he's from the galaxy Realness. Galaxy Realness. I'm just not from this planet. My aesthetic is like alien-esque, like otherworldly.
What?
We have a patient for you. So we have Phoebe, who had surgery, and I think the surgery probably was a little bit too aggressive. Okay. All right, so she has a little bit of nostril retraction. See inside of her nose.
A little bit of nostril asymmetry.
Let's get her in and see what she
That
wants
looks right
us
up
to
your
do.
alley.
Can we please send in Phoebe?
Hi, beachies, I'm back.
Look, a little. How are you?
I'm good.
Hey, how are
Hi,
you?
nice to see you.
Hi,
I'm just kidding. I bring my best girlfriend.
Oh, no. It's Frenchie, and she brought a friend.
So she has the French accent, and you have a Southern accent.
I'm from Alabama.
We'll get right into the thick of it for a second.
Okay.
What are you coming here for, I think?
Well, paparazzi'd every day, and all these haters are saying that my nostril is bigger than the other, that I have dents falling, and I just feel like things are poking out on my face. Have you ever, like, looked down in a napkin and had, like, particles of bone?
Particles of bone?
Well, kind of like chunks, maybe a
just
few
some junk coming out
boogers,
of your
but...
nose. I never heard of anyone having particles of bone coming out of their nose. So if this really was the case, Phoebe would be in the hospital. However, Phoebe is an actress. I get the sense that she has a flair for the dramatic.
Both are good-looking guys.
Thank you.
Yeah.
I'll leave you my number.
He's a good-looking guy, don't you
I
think?
know. Oh,
You can't stop talking about
I'm a big fan. I think we could be a power couple. Honestly.
Obviously, he'd be the power bottom, I would think, right?
No, I'd need a top.
He'd be the top.
Yeah.
Oh, that might work for you.
I just want to jump over that desk and rawr. Oh, I'm excited now.
You've had some procedures on your nose, right?
I had a nose filler in the bridge of my nose. It was one of those, like a party. But like fillers and everything else, you know, I had a glass of champagne in my hand. I thought, yeah, why not? But as the needle went in, I heard it go crack.
Or maybe the needle hit your bone. When you're putting filler in the face, it's not uncommon for the needle to hit the bone, but not a crack. Maybe that crack was the champagne talking.
What was the goal with the injections?
He was like, I can make it more smoother.
Yeah, it was to make it straight
Yeah,
rather
just
than have
to,
a
yeah,
hump.
just
It'll
like
So
do
that was filling the ratings.
Yeah, fill the
like
ratings.
my nose looks like a penis on my face. It just looks too big.
So you're interested in having it surgically altered, potentially?
Yeah.
You like the slope that she's talking about?
A little bit of a slope I think would look phenomenal. I think straight, like very straight, would make her look very harsh.
Or masculine, maybe?
Exactly.
Yeah, and I'm already type A psycho, so I don't need to be looking any more masculine.
Is that a warning?
Yeah.
Type A psycho just means that you're kind of neurotic, but you're also motivated.
You're just straight crazy. Straight crazy.
You've had 3 surgeries.
I've had 3,
So what happened there?
My first one, both sides did not look like the other. It really, truly was a horrendous nose job. So I went to a second doctor, and it's not anything that I'm happy with. My third surgery, he didn't break my nose. He just shaved some scar tissue. Plus, my nose is very sensitive, so sensitive.
Yeah.
Sensitive, so that's not a good sign for me.
I know.
1, it could be inflammation. 2, an infection. Or 3, she just doesn't like her nose touched. I gotta find out which one of those 3 it is.
To summarize, you're both type A psychos
Oh
who
my God.
want high-risk surgery done on
so
on the
proud.
center of your face.
Yes, I want that.
No big deal. This one's yours, buddy.